Hello everyone. सर्वेपि सुखिनः सन्तु सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात्. Hello everyone and welcome to our CME and workshop on Chronobiology, Swasthavritta and Public Health. Currently, as we know that we are experiencing a rise in the global burden of diseases. Due to this rising burden, challenges in clinical practice are also increasing. Clinical practice is currently disease-centric, drug-driven, and has curative approaches. However, it is the need of the hour to expand the scope of this drug-driven clinical practice and include preventive and promotive health approaches. Emerging evidence on behavioral and lifestyle interventions are changing the paradigms of medicine. The recently awarded Nobel Prize for Chronobiology research provides a glimpse of futuristic medicine. Swasthvritta, a concept of Ayurveda and yoga, emphasizes on adjusting our body clock with nature's rhythm. It includes modifying daily routine to seasonal variations and various non-pharmacological approaches such as diet, lifestyle, and behavior for the promotion and protection of health. With this theme for the workshop, I now request Dr. Girish Tillu, Vaidya scientist, editor of Journal of Ayurveda and Integrative Medicine, and one of the backbones of Center of Complementary and Integrative Health, to formally welcome everyone and share his thoughts.
Thank you, Kalyani. Welcome all for this CME and workshop on Chronobiology, Swasthvritta and Public Health. As Kalyani just stated, the present clinical practice is a patchwork. We have many specialists. We send patients to many specialists, many labs, experts. Still there is a question whether our patient gets health. And there is a serious thinking in the entire domain how we can get health. Doctors themselves, they are not healthy. And this is a serious concern. And how we can have health? With this question, our School of Health Sciences started way back, and we are providing very good training in public health and health research. With efforts of Dr. Patwardhan and his collaborators, many of those are here, Dr. Kalpana Joshi, Dr. Rama Vaidya, Dr. Palep, Dr. Ashok Vaidya, he could not come, but Rama Vaidya is going to share his vision. Many of the collaborators, they have worked for more than 2 decades in the areas of various approaches of health, and especially Ayush systems. Our university has initiated a center formally last year, and we inaugurated the Center for Complementary and Integrative Health in this August at the hands of Dr. Soumya Swaminathan and Dr. Rajesh Kotecha, Secretary of Ayush, and we had a big conference on futuristic approaches for health and how Ayush systems can be used for effective health research and creating healthier nation and society. This CCIH is engaged in research and training in various domains, and we have a certificate course on integrative dietetics, evidence-based Ayurveda, natural product and Ayush systems-based drug discovery. And this center is actively participating in various activities, bringing people together, and many of our university departments are also contributing to research. For this particular workshop, we thought that the emerging domain of preventive and promotive approaches, many things from Ayurveda and yoga we can use for making our nation healthier. And hence, when Dr. Palep's trust and Dr. Palep suggested that let us have such a conference, on Swasthavritta and public health, we joined hands, and this is the conference in the series of several workshops that Dr. Palep has organized. This particular workshop brings expertise from various areas together, and clinicians, yoga experts, Ayurveda teachers, biologists, geneticists, endocrinologists. We are going to have an academic treat in this symposium. So I welcome all to this symposium and request Kalyani to take the proceedings further. Before she takes, I will introduce Kalyani and our team. Kalyani Kumbhare, she works in JIM editorial office, and she has done her MSc in health sciences. Radhika is also MSc in health sciences, and she looks after our integrative dietetics program. Akash Saggam, he's our PhD student, and we have a very good team. Welcome to this interesting symposium.
Thank you, sir. We all know that health is not only about maintaining our internal environment, but it is in fact about striking a balance between our internal and external environment. Maintaining this balance is very necessary because it has important implications on Swasthavritta. Our first speaker for the day is Dr. Rama Vaidya, a renowned physician scientist. After completing her medical education in India, Dr. Vaidya specialized in reproductive endocrinology from Yale Medical School in the US. She is a pioneer of the discipline of Ayurvedic pharmacoepidemiology. She is the recipient of several awards and orations, including Foundation Day Oration of ICMR's National Institute for Research in Reproductive Health. Presently, she is the Dean of Medical Research Center of Kasturba Health Society, Mumbai. I request Dr. Rama Vaidya to commence her talk highlighting the neuroendocrinological mechanisms and their implications on Swasthavritta.
Good morning. So, Dr. Palep, how are you feeling? Good? Traveled all the way this morning, huh? Yoga? Lovely. So, shall we say Om then before we start? So, we calibrate our brains. Girish, where are you? The culprit. He called the other day and asked for Dr. Vaidya, and I gave promptly the phone to Dr. Vaidya and invited him to give a talk. So he said, no, I'm not coming because Dr. Palep has created some 6 workshops, am I right? I should thank him, but partly I'm not thanking him also. I always say that for 20 years almost, am I right? Dr. Vaidya and you have made tremendous attempts to integrate or integrative efforts. So when he said no, and I put the phone down, Girish called again and said that, Rama ma'am, can you give a talk on endocrine rhythms and chronobiology? And my first reaction was yes, because that wouldn't be that difficult. But from behind, Dr. Vaidya says its relevance to Swasthavritta. Now, that will be an attempt I would make, and I may not really succeed completely. And with now Dr. Vaidya's permission, I start. So biorhythms, most light-sensitive organisms living on Earth adapted to daily and seasonal variations of luminosity and temperature resulting from Earth's movement. But when I entered this hall, I asked, is there air condition? So I think human beings have made it convenient for their comfort. How far that is influencing our health, we'll see, in terms of temperature and light both. So chronobiology is a field of biology that examines periodic phenomena in living organisms and their adaptation to solar and lunar related rhythms. How many of you see, maybe in Pune it's possible, the new moon and full moon? We don't in Mumbai. And Mumbai is Diwali all throughout the year. So, and 24/7 culture of work. So today we are bathed by lights that have the same potent wavelength that wakes us up to. So our transition to nighttime physiology has been delayed by hours. I quite like this. Kalo I'm Niravadi, Vipulascha Prithvi. So the time is infinite and Prithvi is vast. It's poetic. So circadian rhythm around day, 24 hours time cycle. And we used to have, I think this is the most important message that I feel, that each one has to take responsibility of one's health. And so you have to follow your daily regimen and also seasonal. And this morning I was talking to Dr. Vilatan and I asked him what time you go to sleep, and he said at 10:30, and he gets up at 4:30. How many of us get up at 4:30? Just raise hands. Huh? Not a single one. Oh, you do? 5:30. Okay, great. You also, Kalpana? Wow, that's great. That's great. Wow. So there are some. Yogacha is this very nice. Okay. So I was just looking at how is time defined, and Dr. Vaidya interjected and said that could be samsaric time, sankarshan, and sanatan. And so that the first one, samsaric time, gives us linearity, while sankarshan gives transcendental, and sanatan is eternal. I think what's very important is our anubhuti. The linear time can give only lokik anubhuti, and transcendental can give us divya anubhuti, while sanatan is para anubhuti. Very rarely we get into transcendental, and that's the intuition. Intuition helps quite a lot. The rest of it is good, but the want of time, I will go straight. With the effects of global warming, what's happening to our seasons and ecosystems? In Mumbai, in October, we were expecting at Diwali time we will not have rain, and yet we did. And what's happening to Chennai right now? Flooding. Flooding could be man-made, but partly it is a man-made global warming which is causing so much of problem. So that's why my message to my Ayurvedic colleagues, those who are specializing in Panchakarma and outcome measures, how are you doing this Ritu Shodhana? Maybe if we have time and that's a possibility of discussion, we should do that. Or even at lunchtime, please. I'm not an expert. I would not stay on this, that's why. But I have always looked forward that wherever there is a possibility, now for the public, when they go to Ayurvedic physicians, all of them not necessarily have possibility of Panchakarma. Coming back to neuroendocrinology, a circadian rhythms that influence on 24-hour time cycle. There is a master clock and located at the suprachiasmatic nucleus in the hypothalamus, just above the optic chiasma. and it gets synchronized every day by retinal signals emanating from light. The master clock coordinates the oscillations of the peripheral clocks also. The peripheral clocks, that is in the organs and systems, as well as cellular. And so, Zeitgeber, I may not be pronouncing that correctly, photic and non-photic. The photic ones comes from 20 hours, 24 hours light-dark cycle, and the other one is sleep-wake cycle, physical activity, meals, and social time. So the connection linking retina to superior chiasmatic nucleus to pineal gland, it is a photoneuroendocrine system. Jean Jacques in 1729 published an observation that the heliotrope plants, which opens its leaves during the day and folds them at night, will do so even when placed in constant darkness. So there is a rhythm within which is independent also. And so he did that experiments. Many plants move their leaves during the day, leaves horizontal during the morning and afternoon, and light when the light is not very intense. But when the plenty of solar radiation is there, they become vertical. And that is the protection. So the self-protection. Now, molecular clock of SCN, it's a negative feedback loop involving clock genes and clock BML1, PR1, PR2, CRY1 and 2, and these transcriptional factors interact and activate PR and CRY gene expression. Kalpana, are they said as PR? Because I know that the periodicity, but so PR is okay? Yeah, and CRY, and also if that's a period, and I know that is also, so but when you want to say per gene, okay, and CRY gene, can I cry out? Okay, by binding to an E-box in their promoter regions. And then what happens is that these proteins heterodimerize and translocate to the nucleus and inhibit clock BML1 induced gene expression. And when this complex is degraded, the cycle starts again, and that's 24-hour cycle. Now, neuroendocrinology, the credit is given to Harris as the father of neuroendocrinology, because he established neural control of the pituitary gland, that it exists, that hypothalamic hormones through via portal circulation gets into the tropic hormones, FSH, LH, so all those tropes, gonadotropes, thyrotropes, they are stimulated by hypothalamic hormones, and then pituitary hormones are secreted in circulation. But it was our own learner at Yale, and Dr. Vaidya had an opportunity to have many times on tea table discussions with him. He's no more, a dermatologist who discovered melatonin for its effect on melanocytes in frog in 1958. So I'm pointing out more towards, because we all know by now that melatonin is a key molecule in the field of chronobiology, regulating human sleep-wake cycles. But this article is good because they do give credit to both of this, Harris and Lerner, and they go on straight to talk about melatonin. So melatonin is an indole synthesized from L-tryptophan via serotonin metabolic pathway. So L-tryptophan, rich food, and I think there are some nutritionists here, dietitians here. Am I right? Yeah? Yes. So I think we should have a list of these, and I at least advise my young PCO patients who get into a habit of sleeping by 2 o'clock in 10th and 12th standard, and they can't go back to their normal rhythm. Even later on they want to. And that I do tell them that there are some diet food substances which are rich in tryptophan, and that can be taken at night before they go to sleep. Now the part of the, here you can see the melatonin daily secretion. It starts going up at about 8 p.m. Maximum secretion is at night between 2 and 4, and then it promptly comes down in the nadir is at the morning time. There are male-female variations and also seasonal variations in amount of melatonin secreted, and the levels are most in winter season. And overall foods impacting the availability of tryptophan as well as the synthesis of serotonin and melatonin may be the most helpful in promoting sleep. And this Frontiers in Neurology 2017 does give quite a bit of an insight. We won't have time to get into that detail right away. Those who are interested, and I don't see again Girish here, he must be busy. But those who are interested in public health issues, they have cried out for both noise pollution and light pollution. Historically, light-dark cycles were dictated by the solar day, but now humans can extend light exposure by switching on artificial lights, which we just mentioned about. But more than that, I don't know how many of you have daily contact with youngsters in terms of that they visit you for their problems. They're not able to sleep because of WhatsApp, computers, and assignments that our generation, not my generation, I'm not right now a teacher, but I'm sure, Kalpana, all of you give assignments. And those assignments, writing reports, writing for funds, the grants, all this keep at night, and the blue light is the worst. The lights from computer screens, smartphones, and tablets emit light of all colors. Virja, I hope we are not doing that to you, huh? At MRC, we don't do that, do we? But it's blue in particular that pose a danger to sleep. Blue light prevents the release of melatonin. Beyond sleep and circadian rhythm, melatonin has many important health benefits because it is potent antioxidant, anti-inflammatory hormone. And so dietary quality and intake of specific nutrients can impact regularity of hormonal pathways to alter sleep quantity and quality. Current evidence suggests that extreme of sleep duration alters sleep patterns, hormonal levels, and circadian rhythms, which contribute to weight-related outcomes. Because when you don't sleep, you do try to eat to induce sleep. And when at night, particularly during 10th and 12th standards, parents help you with a dense, energy-rich food so that your brains continue to function while you are trying to read at night or study at night. I have come across so many cases where the history is same, that their weight gain of 20 kg and more sometimes occurred during those board exam periods. So during daylight, serotonin is stored inside pineal site. With the onset of darkness, post-ganglionic sympathetic outflow to the pineal increases, and the consequent release of norepinephrine onto pinealocytes causes stored serotonin to become accessible for intracellular metabolism. During daylight hours, the retinal photoreceptor cells are hyperpolarized and inhibit the release of norepinephrine. So nature has given such a nice mechanism that we store and then we release only when it should be. And then intrinsically photosensitive retinal ganglion cells, they are not rod and cone cells, but these are different, and they are microscopic gatekeepers of sleep. Such a beautiful arrangement. And they contain photoreceptor melanopsin that transmits ambient light messages via the retinohypothalamic tract to the suprachiasmatic nucleus, and melanopsin responds to light even without presence of rods and cones. This explains why circadian rhythms aren't necessarily disrupted in the blind. Now, pathways in circadian system are direct and indirect. Direct is neural, and it's so important for all of us to see that the sympathetic and parasympathetic remains balanced. Most of the time we are in a sympathetic hyperdrive. That's why we said Om and Om Shanti Shanti. Perhaps every few hours, if we take a deep breath, that also balances our parasympathetic sympathetic. Then there are hormonal signals, pineal secreting melatonin and adrenals secreting glucocorticoids. How nature has balanced this beautifully. So you can see that the cortisol secretion occurs maximum when melatonin is coming down. And so when the cortisol is about to come down, and we always have to look for endocrinologists that this is not a Cushing syndrome where the diurnal variations are lost. And diurnal variation is such an important phenomena for the adrenal functions. And then as it has dropped here, melatonin has started rising. And this also optimal physiological effects of GC occur when central signal that controls rhythm of glucocorticoid release and the peripheral rhythms in tissues expressing the receptors for glucocorticoids are aligned at this time. So then these two systems work together beautifully. Now I'm coming to show you what happens. No, these are still night dark, afternoon bright, and early morning bright light. When these transitions occur, what happens to TSH, melatonin, cortisol? So partly we have looked at this, so I will go straight to the next slide, which also shows that most of these trophic hormones and the endocrine hormones have episodic variations. And these episodic variations are so important, and most fascinating is for the reproductive menstrual cycle and ovulation, that there is a negative feedback and a positive feedback. Otherwise, how could there be a rhythm of this 28 to 30 day cycle? So what happens? We did see what happens in winter, we did see what in male, what is in female, what happens during the day and night. We had not seen what happens to some of us. We are for melatonin secretion here perhaps. Melatonin secretion starts going up in children, it is the most, and then at the onset of puberty, melatonin has dropped, and then it continues to decline. With that, you can see how much is the difference between the adolescents and here. I have not settled down on this as an advice to my patients. They say that during puberty and adolescence, you require almost 8 hours of sleep. And that's perhaps just not possible in current social, academic environment for that age group. So melatonin-rich diet, melatonin pharmacotherapy, and the last moment I try to, maybe somebody from you would ask me, what is the dose that can be given? Most of the time people, if I'm not mistaken, Dr. Palep, they pick it up on over the counter, and particularly those who are traveling and going to different countries with time zones are different, they pick up melatonin. My colleague, Dr. Nandita Palsetkar, wanted to attend this workshop that you had created, and she had just come previous night. So in order to fight jet lag, she had already swallowed a pill of melatonin. Now there are experimentally, so the clinical research is going on, and in melatonin pharmacokinetics, following 2 different oral, beautifully surge and sustained release doses in older adults have been tried. And then what happens is that the surge gives you first push for sleeping, and then it is maintained throughout sustained release. A question is that when it should be terminated, when it should be given, how much it should be given, and the time should be known. When I was interested in looking at those who live beyond 100 years, I picked up a book in Sydney. I had gone for a conference, and in that, what came out that who lived the longest, and I'll come to that later. But there was also an experiment that was shown in that book, and that is here seen here. It is a cross transplantation of pineal gland between the younger one to the old and old to the younger one. What happened to the old, that animal lived longer, and the young lived shorter life because of the pineal being exchanged. Now, Dr. Vaidya, Dr. Bhushan Patwardhan and others are extremely interested in Kayakalp, and there is a documentation, and a judge has written this book which says that Tapasvi Maharaj had lived up to 180 years, and he had gone and done Kayakalpa experiment for the Malavyaji in Banaras Hindu University, and it seemed that, and there is if you go to internet, you will have beautifully described what all it is all about. So there is an urgent need which says that understand reprogramming mechanism of melatonin to translate experimental research into clinical practice for halting a growing list of developmental origins of health and disease related NCDs. What I do find in my practice is a young girl having polycystic ovarian syndrome, and 50% of them have high insulin levels, fasting as well as post glucose. So I divide normally for glucose and insulin into 4 quarters. The first quarters is normal, where glucose, fasting and post glucose, blood sugars as well as insulin are normal. On the extreme are insulinopenic, are already diabetic. And few do come type 2 diabetes at the age of 20. So that's an advancement of the age that has occurred. What would have occurred in past at the 50 and 60 years or even beyond has started coming earlier and earlier. In between are 2 pre-diabetic states, pre-diabetic and pre-diabetic. Already IFG, that is impaired fasting glucose, impaired glucose tolerance, which are very close to diabetic then. So when this very recent article which is talking about reprogramming is talking about all these NCDs, then I was reminded about Dean Ornish. How many of you have read Dean Ornish's Reversing Pharmacology? I mean, Reversing Heart Disease. Reverse Pharmacology came to my mind. So yeah, some of us have read that, right? And if you remember the story of that, do you remember the story of that? That he was a medical student and was very depressed, and he goes to meet his sister, where he meets Sachidanand, some Swami, I think it was and there he learns yoga, and then he changes completely, and there he has come with the reversing the heart diseases and this reprogramming. Read this article, reprogramming. So nice, no? The circadian clock controls sleep timing through the process of entrainment. Chronotypes describe individual differences in sleeping time. Somebody has done this study at modern chronotypes, and you can see here modern chronotypes in green are only few. Majority are owls, few are larks. So social jet lag, discrepancy between biological and social time of modern society. We are very much interested in school health education and enlightened living program of earlier Bhavan Spark and now MRC-KHS. A recent study we did with Dr. Shobha Udupi, nutritional scientist of great order, and we did this at a school with a high socioeconomic group. Look at this, how many sleep children only for, even this should go with a red color, but we didn't. It's more than 1/4. So what did we requested the principal and the school authorities was, can you delay your shift time a little bit, that they don't have to report at 7 o'clock? No, we have another shift also. In United States, they have made this. That has made a lot of difference. If children can sleep beyond 7 hours, at least, their cognition would be much better, and then learning, and then joy of learning they'll experience. But there are many things also we have studied. We won't have time about that SHIELD project. But sleep debt of modern 24/7 lifestyle and ill health. You can see here various endocrine markers. This is 4 hours in bed, that is 8 hours, and this is 12 hours. You can see what happens to HOMA IR. Chaya, you can see this? Insulin resistance in those who have less sleep, and it is a kind of a dose response. Cortisol, I was very much fascinated to see this, Kalpana, that what should happen, by this time it should have come down, and it is reluctant. It gives you sympathetic hyperdrive also, not only cortisol. And then growth hormone is also very interesting. It is a biphasic response. There is an attempt at a time when you should be sleeping, growth hormone goes up. But it comes down because you are not sleeping. And then what happens is there is a biphasic. So leptin comes down, and leptin is a hormone that will declare, I'm hungry, I'm hungry, I'm hungry. So even beyond your thinking, you will go to the kitchen or wherever the food is stored, and you are likely to grab food before anybody watches you if you are dieting and somebody is monitoring this. Because leptin does not allow. And this slide doesn't show. Now the next slide will show ghrelin, which is the one which increases the appetite, regulates the appetite also. And then sympathetic parasympathetic imbalance that occurs can be seen here. So once again, the effect of sleep deprivation on leptin and ghrelin levels, hunger and global appetite rating. After 2 days of 10 hours sleep time is blue, and this is after 2 days of 4 hours sleep time. So leptin has come down, ghrelin has gone up, hunger goes up, and global appetite goes up. This is a genuine problem, and I wanted Girish to be present here. Girish, at school level, see, when I was very active on SHIELD program, as I came out of an academic career from IRR as a deputy director, and I quit. While I was waiting what I'll pick up again for research, I thought that I can easily do school health education. And we have 7 topics for school health education. I think that we can exchange thoughts on that, and at school level if we'll do, it would be very useful. We can't influence the corporates and their culture, but we may be able to see that our next generation would improve. So this summarizes, I won't waste time on that. This beautifully summarizes, this is again Nutrition and Diabetes 2017 article. Now, this girl was brought to us by her mother, and she was in 10th standard, 9th, 10th transition, when there are so many classes started on. She had put on 20 kg in a short period of time, and mother was extremely worried. You can see, you don't have to do serum insulin, you can see acanthosis. So weight gain, obesity, central obesity, acanthosis nigricans, hirsutism, irregular periods, what all you need, it is an insulin. So what had happened to her lifestyle? She was a dancer from 5 years of age. Come 8th standard, Arangatram is done. Then physical inactivity. As such, physical inactivity contributes, is a high risk factor for insulin resistance. But what happens if you are very much physically active and suddenly you get into inactivity is the worst period. The body is not used to this inactivity. Then there was a hyperphagia, preference for junk food, calories also was 2,672 per day. Sleep was also curtailed, and we took her for Steps to Swasthya program, and I'll come to that later on. So we have now here 43 PCOS women, and there you can see here insulin levels, PCOS and control, and FGFI ratio shows insulin resistance, and leptin, look at this, adiponectin is also less, and high CRP. This is a highly inflammatory condition, chronic inflammation, obesity. So PCOS is a chronic inflammatory disease. And what happened to the mother said that doesn't matter, even if it's an academically very important year, but she has to lose weight. And her improvement in memory, concentration, no hyperphagia, periods regularized. She participated in 10 where we were deliberately doing monitored medical nutrition therapy, which we had shown that not only that insulin levels come down, their periods get more regularized, they lose weight, but also their inflammatory cytokines come down. And that was a proof of it. And she has, and this was quite a time ago, she has come to me 2 years back, she has maintained the lost weight. So she adopted. So behavioral change. And so Girish Bhai, you will need somebody who would help you for behavioral change. And I think Pune, it is possible, I'm sure. And so changes in mean weight, WHR, weight height ratio, fasting glucose, 2 hours fasting glucose in adolescents who were on that monitored therapy in 10. You can see here that mean fasting insulin came down, and still it's high, still this is high, but at least because it did not normalize in all. Now, I had nostalgia and I thought I'll share. Can you identify where I am? Now I could move, Girish. Where am I sitting? Huh? Nobody can identify me? Huh? Where? This is me. We were 5 brother sisters, 2 elder sisters, and 2 younger brothers. My elder sister is no more, and I could not trace her, but this is Hansa, my elder sister, Bharat, Dilip, and myself. And it was a very happy family. We were in outskirt of Morbi, a small town, that too outskirt. And mother used to get up early. She did not know that even milk has also rhythmicity. Night time, and there are beautiful experiments shown that is in the literature. So she used to get up early, 4:30, and Govadia used to come. Both of them together would do this. And we used to have nice rotla, makhan, and all those things. And we had really this dinacharya till the age of 12 years. Very regularly. We were also, and these are not me, but we were taught not Indian classical music. My mother used to learn Dilluba, and then we were also made, we had well also, we were made to fetch water, and I also used to compete with my sister that without doing this, can I walk with 3 pots and not doing that, so one could balance that. So that was it. And what were the seasonal variations? At home, in winter, Chavanpras was made from Avla. She used to grow vegetables in our own garden, backyard. And that's why for Shield project, I had created a kitchen garden at Bharati Vidyavan school. And in kitchen garden, we said that they must identify. And during those classes, I used to say, go to the market and find out how many vegetables are there. And I did not know that there were 40 different varieties of vegetables. And then she used to make, on the other side, gulkand during summer. So this is only nostalgic memories. Very interesting story, and that's why I brought this. Now you have packaged herbal natural datun of neem, bubul, etc. It's a mint flavored. So somebody ordered this and said that why should I keep on ordering again and again? So order a big bulk, put it in a jar. After a few days when he opened it, there was so much of fungus on it. So I'm going to make a statement, particularly for my Manali and for Virja. If you're driving on a highway, the speed limit is written 80. would you want to say that I'll go at 30? Can you do that? So when we talk to policymakers, when we talk to those who run public health institutes, those who treat patients, be kind to our younger generation. Their competition is fierce. We didn't have that competition. My mama used to had regular oil pulling. He used to use sesame oil very regularly. So these were the impressions we had. We could follow. My age, 12 years, we moved to Mumbai, followed the same kind of a regimen for a while. Later on, what I said has happened. That if you are on a highway and it's written 80, you can't afford to drive at 30. But in between, take a deep breath, do your exercise in the morning. Definitely yoga has lots of good, there's no question about it. And can we allow some daylight through in the indoors? And that's why I think today's architects are making some efforts to do that, so that you don't have artificial light during daytime. And I thank this trio for globally so far making an attempt for all of us, for their work and for their Nobel Prize, that we could celebrate and felicitate them. Thank you so much for your patient listening.
Ma'am, that was not a nostalgia, that was a case study. A comment here that we have invited the speakers and experts. Those are living all these things themselves. I'm Rama ma'am's student, and I'm working with Rama ma'am since last 20 years. She's 77. 81, I'm sorry. She's 81. No hair dye. She yeah. But she works.
And from my previous, my mother, I remember this morning very much, that how educated they were in, I think, the pre-independent. How many are here pre-independent? Is anybody pre-independent? Thank you. So I have some company. Dr. Nathan Case asked me when I went to States, Rama, you're telling me a lie. You're not a vegetarian, are you? I said, well, I am not totally, because I'm a lacto-vegetarian. That much animal product I have taken, that is milk. And that milk was also so fresh. My mother would milk and give it to us. She would make navneet, she would make ghee, how sanskarit ghee that she would make. Also she would make it for our hair oil. All these are really nostalgia, in the sense that I'm sure that my age group, they will say that. It was a Gandhi era, where again Swadeshi. But again, be kind to your youngsters. No lectures to them, but examples that they enjoy what they did this morning, perhaps here, of experiencing themselves, that what yoga can do. I really learned, to be very honest, yoga at Yale from a French woman. And then I continued doing yoga for a very long time, every day regularly. So I think some of these things can be incorporated. Some of them will come in form of pills, and we would use that. And some as achar, vichar, vihar. Thank you. Thank you so much.
So, this comment was not just to share information, but this is an opportunity for all of us. This is a workshop to interact with dignitaries. So at the age of 81, she practices as reproductive endocrinology and contributes actively in research. Thus, this Swasthavritta and all these things, these are living cases that we can have. And one of the things of the present era is we are living hope. How we can achieve something in which we are not simply believing in. And thus, the experts and the resource person here, Dr. Kalpana Joshi, Dr. Bhole sir, Dr. Girish Velankar and Dr. Pathak. They are themselves yoga practitioners, and I urge all the members to interact with them and know more about this topic. Thank you, and over to Radhika or Kalyani.
Thank you, ma'am. I would like to request Dr. Palep to felicitate Dr. Vaidya. Dr. Palep represents true integration of Ayurveda and modern medicine. After his graduation in Ayurveda, he completed education in modern medicine. He is a gynecologist by profession and authored a book, Scientific Foundation of Ayurveda.